Hi everyone, Dr. Rich Castellano, the Smile Doctor here at ImageLift. In this video, I want to discuss the different types of local anesthesia lifts that we offer. We offer 4 basic lifts: our Deep ImageLift, the ImageLift, the Mid, and the Mini. What's the difference? Well, what I'm going to do, I want to get right into it and just show you. I can share my screen here, and that is what I want to see right here. That's perfect. We're going to share. So what you're looking at here, I'm just going to get started with, there we go. So this is the Deep ImageLift. Now, when I do the Deep ImageLift, you can see there's more tissue in the neck and we can get a better result. So the Deep ImageLift enters the deep plane. It is not a traditional deep plane lift. This patient had lift and laser and looks very natural, of course, never goes too far. This is all done under local anesthesia. So the deep plane lift, this did laser and filler and deep lift with this patient. We preserve the salivary glands, we preserve the muscles. There's no drains, no staples, but you can see the deep lift gets a really good result. This is combination treatment, Deep ImageLift with fillers and laser resurfacing. Looks very natural. What's the difference with all the lifts? When there's more tissue, the deep lift allows me to do more. The difference is the time it takes me to do the treatment, the artistry, and the price. So the deep lift is a wonderful option. We have some patients with really big necks that do not think, oh, I couldn't do a local anesthesia lift. We can absolutely do it and get wonderful results. This patient visited from out of state, came back the next year, told me their family members and friends said they didn't notice anything. And this is such a big difference. When it looks natural, it looks good. The best lift looks like you never had a facelift. Lucy's a former model, and you can see what a nice difference it did here. Now let's look at the ImageLift. The ImageLift is a step below, but still a great result in the sense of great improvement here. Jeannie is a nurse. ImageLift still gets a great profile, does not enter the deep plane, but is a larger area that we operate in. She also did her eyelids. So the ImageLift gets great results. This patient here had these melolabial folds. We did the lift plus some filler, so combination results there. She loves the smoothness of the jawline. So the ImageLift is a step below the deep plane ImageLift. The Deep ImageLift is our $25,000 lift. The other lifts are less, and you can come in for pricing and customize for what's best for you. So we have patients from all across the country, internationally, that come in. They want the safest treatments. This gentleman's a former executive at IBM, got a wonderful improvement in this is doing an ImageLift procedure. Again, ImageLift. Now let's compare that with the mid-lift is essentially like doing a mini lift, but with little stitching under the chin. So some patients don't need that much. You can still get a really great improvement doing the mid-lift. This is variable. People have different anatomy, different expectations. So when you look at enough pictures, you can get an idea of what can be right for you. This is laser resurfacing plus the mid-lift. Now let's talk about the mini. The mini is if we do no stitching under the chin. Really nice result here, and you can see there's still a little bit under the chin, and that's okay because the mini can leave something to be desired under the chin. This gentleman had a lot here. I recommended we do some stitching under the chin. He just wanted to do the mini, and really great improvement. But if you see, there's still a little under the neck here, so he's happy with his results. This gentleman got some tightening along the neck and jawline, but you can see the shape of his jawline improving. So this is the mini lift. Now, what I'd like to do is just give you an idea from, this is a diagram. The Deep ImageLift repositions the deep plane, and it enters the deep plane. It is not a traditional deep plane lift, but you can see in the ImageLift, these lines in blue, these are the areas that we are going to be focusing on to get your improvement with the ImageLift. Does not enter into the deep plane. The mid-lift is kind of like doing a mini with some stitching under the chin, and then there's the mini. So the difference between these lifts, let me see if I can address here and see if it'll allow me to stop sharing. There we go, I'm back. Okay, so those are my summaries of our mini lift. If you add from the mini, a little stitching under the chin, it's a mid. If you go to a bigger, broader area, that's the ImageLift, and then we enter the deep plane, reposition this mask layer. Think of it like this, there's 2 layers, 2 masks on top of the skull. We lift up that skin mask, we tighten that muscle layer. With the Deep ImageLift, we actually lift and reposition that muscle layer. The ImageLift Mid and Mini just tighten and tighten up that mask layer. So there is a difference in the artistry. questions, let us know. We've got the right treatment for you. And of course, we add this to filler treatments, laser resurfacing, eyelid treatments, whatever you need, face and neck, we've got you covered. Thank you for watching this video. More videos coming soon. Give us a call. We'll see you later.